Good morning to all. Now you have to bear with me. That is a problem now. And that will be for some time. That is for 2 presentations you have to bear with me. And the topic, maybe one of the topics it's a very important topic. But yesterday as Dr. Vasireddy told, it's a boring topic. When we hear this topic, generally we have a tendency to wave off. Mainly analysts have a tendency to wave off because it's challenge. Many regulatory requirements are there. Many even national requirements are there because it's a challenging topic. It's verification, validation of test method. So basically I'm just introducing myself. I am Anoop Krishnan. I am done my PhD in bioscience from Bangalore University. I have worked for around 15 years in residues and contaminants. I started my career from an ICR institute in research. So then I moved on to a quality control department, that is the Export Inspection Council of India. Maybe you can tell my career started here in this lab, pilot test house. Around 7 years I worked here. Now I oversee the lab at Export Inspection Calcutta, where it is now almost 3 years now. So before going to, I'll just cover a few things, mainly on just basics of what is validation, what are the terminologies in measurement science, verification, validation, where we should use the validation data, because that's a challenge. Because many labs, because I also do some audits, so it's all, whatever I'm going to talk is all practical experience. Maybe so many slides you will see, but I'll be speaking of my practical experience only during the whole presentation. Because that's why I use a validation, because whenever I go to a lab, I've seen one thing, all the validation documents are in the cupboards. And generally it is being brought by the quality manager of the laboratory. See, the validation data is to be used by the analyst, and I see it inside all cupboards. So that's a challenge, that's why I put it. And just how to do a documentation also. Just to start off, I just want to know, what is this? This is a slide, who, what, how, where, why, when. This is there for everything, but it is very specific for method validation. So I just want to know who all people are really involved in validation. See, I know it's a multi-group which is sitting. Some may be analysts, some may have done it, presently may not be doing it. So I just want to know who have done validation and who have done verification, because there are 2 terminologies we are using fairly. So, and just want to understand from each other what is validation and what is verification. Basics, not definitions, just what we have been doing. Anyone can tell who have done it, really who have done it in their lab. So anyone can tell. No one has done validation.
When mathematics you perform different metrics, we need to check several parameters like specificity, linearity, recovery, ruggedness, robustness. So when you consider all these things, it is called validation. And when you are just checking the performance of a method, so then it is called verification.
Yeah, it's almost.
Validation means it is the criteria for selection, whether it is fit for purpose of doing the analysis. And verification means the performance check of the already validated method in our lab.
It's almost all are.
Generally, for non-standard methods, first we validate and if any standard method is present, then we verify it in our laboratory that fit for the purpose.
So I think what he has told is more closer, more precise, what he has told in a small sentence. So this is going to happen in validation, who, where. It's a big confusion for us, what. Just to tell you an introduction, see, the purpose of any analytical measurement is accurate, reliable and consistent data. These are the 3 words which will be always there. These properties which are told, these 3 properties which are told, can be judged by the results obtained either through method validation or verification. See, and it's a good, our topic of workshop topic is good food laboratory practices. So again, I am telling you, it is a good analytical practice. And in this aspect, it's an important requirement for any testing, because we can't waive out any test in a laboratory, either goes for a validation or a verification. Without that, it's difficult to live presently. And see, this is laid down clearly in standard. I think almost all would have read ISO IC 17025, 5.4 clause really address it, test and calibration method and method validation. So my focus today will be completely revolving around 5.4. Again, just standardized methods, as he told, same thing, standardized method goes for verification, and modified standardized and in-house method goes for validation. So it's very simple. I think it's all written in the standard 5.4. So there is, if you read it, it's very simple. There is something else also which comes when validation we hear. That is like equipment. Some people tell we need to validate our equipment. Validate, yesterday I think Dr. Vasireddy was talking about a challenge, validation of softwares. It's a big challenge, because many times the vendors change or upgrade their software. So generally we have a tendency to do an IQ, instrument qualification, and a performance qualification, or no, OQ, operational qualification, when you purchase an equipment. So that time they validate and give. But however, after some time we can see that they just tell that the software has been upgraded. So then it's a big challenge for many laboratories. Ideally it should, that time also, the software, maybe if there is a change in the hardware, that also should be validated. So method validation, it happens in different items. See, just to bring in, I think these are few things which you hear daily, which are hidden actually. When we start off method validation, you don't hear much things. It's a hidden thing. I think error, many people talk random error, bias, trueness. But when we hear all these things, we get confused. It seems to be same everywhere. See, error, what is suddenly something called random error coming, bias. There is a confusion, what is bias, trueness. It's simple, just what it is I have written. These are comments which you can read later. This is just to know. It's an error is a result minus the reference value. A random error is component of error that varies in an unpredictable way. Bias, it's a systemic error or systematic error. Trueness, it's again, these are definitions, closeness of agreement between the average of the infinite number of results and a reference value. Accuracy, again, closeness of an agreement between a result and a true value. Then something, these are all things I think you hear it day in and out in a laboratory. Precision, closeness of an agreement between results obtained from replicate measurements on the same object under specified condition. Then one more is there, uncertainty, I have kept it. It is, see, if you tell me it is, we ideally should speak as analytical measurement uncertainty. See, the terminology written is measurement uncertainty, but we are not really doing measurement uncertainty. Measurement starts from sampling actually, because sampling is an integral part. We had discussed yesterday, many of the speakers have stressed and focused on sampling, and it is critical. So for me, it's my views that it should be analytical measurement uncertainty. Just again, I start off with verification because that is the safest one and the easiest one than validation. Validation is a challenging topic. So just, it's all standards which are telling both ISO 9000 and ISO IC 17025 tells about the definition. It is both same. It's confirmation. Again, it should have an objective evidence that the specific requirements has been fulfilled. Standard, I think many of us have read it, but standard gives a more precise definition. Method verification gives a confirmation to the laboratory that it can properly operate standard methods before introducing the test. And it tells that if standard method changes, the confirmation shall be repeated. This is written in ISO IEC 5.4.2 clause. Now this is a thing, see, we standard method, we import it. Indirectly we purchase some standard and then we start doing it. So it's like importing. See, all method in the standard method means all development things have been done. There is nothing you are going to do. It has already been developed. Method performance is understood. Official methods, actually these are official methods. used to settle dispute. I think in Codex UCL 2, most of these methods are in type 2. I think you will have a brief idea when Dr. Eric is talking about it. I think he'll give a brief about that. Then inter-laboratory proficiency testing may already be in place. Now, standard method, once it is imported, must show that you can do the method correctly at your own site. See, this is a laboratory. Now, in this laboratory, I have taken a standard method. Now, it's your responsibility to demonstrate. If you ask me, it is 3 M's, the man, the machine, and your method is there with you. So, your man and machine now starts playing the role. Machine will have chemicals and number of things involved in that. So, again, I told you the equipment, the required reference material, cultures, I think standards, reagent media, then your environmental condition will be different. Then the staff, it's also an indication how competent. See, by verifying your method, you also get a confidence that your the analysts who are really working on the bench are competent. And the capability to achieve the performance. That is really listed down in the definition also. Because this will have some performance. Like they would have told this is the accuracy of this method is this, the range of this method is from this to this. Many of the standard method tells it. And the standard deviation has been this much, means the precision. So importing a validated method, show that laboratory can do it on, demonstrate the laboratory can repeat the method performance. Like you should also check it, repeat it and see that we are able to either repeat it and get those same results. Because one time doing is, see, it's one time. When you repeat only, you will know the challenges. Then generally for method performance, when you get a method, generally we have a tendency to do, because this I am going to basics, not some labs may do in-depth many more things like measurement uncertainty, you calculate, many of the other things you will do. But basically you have a tendency to check the detection limits, precisions and the accuracies. So how we do a detection? Spike, that's what generally, I'm talking mainly about a residue or a contaminant perspective. So you spike at some level close to the method detection level, just we verify it, then perform the analysis on the spike metrics at least 7 times. See, statistically, if you ask me, if you have a 5 data or 6 data with you, that is more than enough to do a statistics. See, when you do also, you have a problem that, see, we are human beings when you test. There is a challenge while testing. You may get outliers. So it's just an ideal that 7 times if you do over a span of 3, it's written 3 days, not today, tomorrow and day after tomorrow. Again, don't get it confused. If it is 3 days, it is on a spanned phase. Because then only you are able to reproduce it. Today if you do and tomorrow and day after tomorrow, the conditions may be almost similar. So try to reproduce it. Then calculate the recoveries and the RSDs. Compare the value with those of the standard method, because we are talking about a standard method here. See, now there is a challenge here. This is the one thing. Now, how in detection limit, I have a method, and method generally talk about food, not on particular metrics. So now it's a confusion. I have the method, I have n number of matrices. So it's a challenge. So how many matrices are needed? How are the values obtained compared with those of the standard method? So how you will compare it? See, this is another challenge what you are going to face. That's a verification part. It's just a picture which I have taken from the AOSC International. This you can see fat starts off from a low percentage to a high percentage, protein from a low to a high percentage, same carbohydrates. So now where you will verify it? See, we have talked about detection. So detection generally is at the lower levels. Now at what all levels we will check it? That is another challenge which is being faced, and I feel generally you have a range of testing which is being fixed by each laboratory. You need to ideally cover the highest range and the lowest range. Some labs do a mid-range also. That is what it was written in the previous slide, 3 levels. See how many food matrices are needed. So just a generic statement, less than validation. Professional judgment, yes, again it is always, man is is the key person who has to take the decision. It's not the chemicals or the equipments which has to take a decision. Ideally, we should try to cover the most difficult matrices. Then you also calculate the relative standard deviation, whether it is significant with respect to the other method, the standard method. Then the mean recoveries, whether it is within the acceptable limits. See, just to tell a rough, just an example how, like, ideally people do many statistics. See, as on date, everything is done using an Excel. Standard deviation, your mean, you put the data, no one does it manually. Manually we can do it, but it's again a challenge, time consuming. So ideally people do it using a, even F test which has been told, these are all as on date, they are in Excel, except that the table you need to refer. Just an example, a comparison between, how you compare between two methods. See, just an example, I have told that you have got two methods. One is a standard method and another one is a method, the method you have verified it in your lab. The same method you have verified. You have two standard deviation and you need to just check whether my method is really good or whether it is precise. So you are comparing between two methods. So automatically we go for the null hypothesis. This is slightly statistical. So I'm not going much into detail. It will go above the head sometimes. So it's statistical, but still you should understand that it's a requirement because you have a standard method with you. So you need to compare it. So then you calculate the F cal and you get the value, that is, you have divided the highest value which you have got, square divided by the standard method, standard deviation. The tabulated value, this is from degrees of freedom. It is easy because I have written somewhere the measurements are 10. It is 10 measurements. So degrees of freedom is n minus 1. So you get 9. So in both the cases it has been considered because both the method was repeated for 10 times. So 95% confidence level. I have just fixed that table, that is F table only. So 9:9 you can get that value called 3.17. So in this case I have just told that the method is precise considering that F cal is less than the F9, which is a comparison between the two methods.
Are these two different methods?
No, one is a standard method and one is the data generated in your lab. So you are comparing between the standard method and you are verifying your method.
One method is standard method and you are performing the same method in your
laboratory.
Method is same.
No, you are comparing the methods. See, you want to verify your method in your lab.
But I am using a standard method.
So that's what.
Already been tested.
Yes, but still you have to demonstrate it.
Different.
No, you have to demonstrate it. That's what I was telling, the terminology called verification. See, a standard method can't be directly used in your laboratory. Okay. It has to undergo a verification, which I was talking that you should calculate at least 3 basic things. That is detection limits. You need to check the accuracy and precision. So you are able to reproduce the same method in your lab with your man and your machine.
Okay. So the mean value of 6.7 in SD of 0.8.
Yes, that is from the standard.
It is given in the book.
Yes, it is given in the book.
And the laboratory is getting 8.2 mean and
doing it 10 times and you are getting a standard deviation. So you are comparing, see, you have 0.8 and 1.2. So you are comparing both the standard deviation and you are coming to a conclusion that this method, see, ultimately it is statistics which is showing that the method is more precise if the standard deviation is lower than that of the other method. So you are comparing between two methods and telling that this method is, see, it can be adopted in my laboratory after generating your data. You generated your data, no, 10 data are there. So you are comparing and telling that this is precise and I can use it in my lab. It's just a comparison.
in that case actually we should use paired t-test.
Pardon?
Because
Yeah.
that remains same.
Yes.
So that test we should compare.
No, this is single. Again, I am telling you, I have written it is, we are used one-tailed test.
Okay.
Down it is written is one-tailed, it is not two-tailed. So we are not doing a two-tailed test which we are doing. We are using a single-tailed test.
So,
Yeah.
so if the standard deviation is not available in the original method.
There will be a challenge. There will be a challenge. Then you need to verify your method only because see, you don't have any data which you can take it from there. See, generally it's some methods which give it, some methods may not be given. It based on, see, I've just shown that if it is there, you can compare to the precision of two methods. If it is there, if it is available with you.
If it is not available, then is there any other guidelines?
No, you need to verify your method. You have to verify your method against your defined criteria. Your lab will have a defined criteria with respect to accuracies and precisions. From you can compare it and you see that if it is meeting the required performance criteria, you can use it.
We shall go to the mandatory interlab testing or?
No, this is a standard method. Everything
No,
I am talking about standard method.
Standard method is one side. What is standard method? To get the standard deviation, we will do the analysis 10 times. We will get the standard deviation, repeatability and reproducibility.
Yes.
Suppose that standard deviation I need to compare with the.
For that, no other option. You need to participate in PTs or ILCs.
Thanks.
See again, bias.
I'm sorry to interrupt you again, sir. So what is your conclusion, sir, from this?
See, from this, the method is precise. It is written that
The method is precise.
Precise.
But I am using the same method in my lab. I am not getting that kind of precision.
See then there is a problem. Either the problem is there with your man or your machine somewhere. If it is not getting precise.
Okay.
See, there is a problem. See, you have a standard method which is established from it's an international method. So if it is not reproducible in your laboratory, there is a problem in your lab.
Okay, I have checked everything, but I am not getting any better results. What should I do in that case?
See, that is what I was again telling you. The thing is, your man, you have to do a root cause. Ultimately, you have to do a root cause in your lab. You have a.
Sometimes it is very difficult to achieve that level of precision or accuracy which is mentioned in the document.
That is what. See, these are challenges with respect to. See, there are n number of things which can happen in a lab. Which start off after the method. You have a personnel who is working. So there is a competency of your personnel is under question. When you tell that like it is, you are not able to get the results. The next thing which you are going to face challenge is your machine, your reagents, your chemicals, your environmental conditions in your laboratory. Many things are there which can contribute to that. Because standard method is something which is already established. See, you need to verify it in your lab. You can't directly use it. By virtue telling that, see, if you have a standard method and start reporting the test results from tomorrow, it will be a challenge. You need to verify it in your lab, in your laboratory conditions. And then only you can start generating a report, whether it is any standard method by that matter. And it is very clear in the standard, ISO IEC 17025, that you need to verify. I am here again telling I am talking about verification only. We have not started validation.
Sir, one more.
Yes.
These tables is a
It's
repeatability and reproducibility data, or
this is an F test and it's an F value which is being compared based on the degrees of freedom. It's an F table. I've just put it. The one which is put on the side is F table, and from that only the value has been taken.
where should we get this?
It is available everywhere. I think even in if you start with your AOSC book, the last page shows. Again, proficiency testing. Again, I was telling you there was a discussion again. How will I verify the method? See, it is not. See, if it is not working, there is no meaning in participating in interlaboratory or proficiency testing. That will not give you anything added advantage. If your method doesn't work in your lab and if you are not able to demonstrate in your lab, there is no further meaning in taking it to doing a PT. It's a risk doing PT after that. So again, analysis of CRMs, spike samples. So just to give a rough idea again, slightly modified methods, what you will do. Now, that up to now we are talking about standard methods. Now there is a slight modification in your standard. You are modifying it. Because you told now that you are having a challenge in the same method, I am not able to reproduce. You are not able to get the data. So you think that I will slightly modify that method. So what will happen in that scenario? That anyway, it's wise to have supporting data, prove or state that modifications have no or understood effect. See, it generally calls for a validation. If you ask me, you are modifying a standard method. And how? What are the modifications which are critical? I have written it down. Sometimes you have changed the column. It's a different detector. You are changing the weight, dilutions or other preparation steps. You are changing the solvents. So see, these all things brings us back to the next topic. These are just things which I was talking about, standard methods, wherein which bare minimum things I have talked. Maybe additionally many labs will do measurement uncertainty, many other things will be done.
Sir,
Yeah.
in case of slight modified methods, if someone has already modified it and we are think that this method can be used, someone has modified the standard method and it is already published in the running journal, can we use it, or we should validate it or we should verify it?
Madam, it goes for, see, it is based on, I was telling what is the change done. How critical is the change done in that modified journal you are talking. If the modification really affects the result, means it contributes towards the result, you need to validate it. Because we have no other option but to validate. Because see, you are referring to a non-standard method suddenly. You are going to a journal. You have a standard method.
That standard method is already modified by someone.
Yeah, that becomes a non-standard method. Immediately it becomes a non-standard method. But again, I am telling you, I have given a caution there. See how critical that modification is. There may be minor modifications which may be, see, you are using, in your laboratory, you are using a different brand chemical. They have used a different brand chemical. So that doesn't, these are these are minor modifications. So, but still, when you do and when you generate the data and you see that there is a problem, like as he told, there is a problem, maybe we need to think about even the chemicals that time. That's what I was saying, a root cause may have to be done. See, I go to this topic again, ISO IEC defines separately what it is. It's confirmation by examination of objective evidence that the particular requirements for a specified intended use are fulfilled. Again, simple, it is fit for purpose, nothing else. It is also written in the standard. Ultimately, one more thing always will happen is, by doing this, it should also meet the requirements of customers. See, some customer may tell you that I want this method only. They may even tell you a journal. This is a published journal. I want you to use this method only. So that again, some importing countries may tell you, you have to use this method or you need to validate. See, you may be using a standard method there, but the importing country is imposing you, no, you need to validate. No other option, because it's a customer requirement and you need to validate that time. Again, what you are doing, by doing validation, what all you are establishing, performance characteristics or performance criteria, it's almost same, slight differences there. Limitations of a method, identification of the influences which may change these characteristics and what extent, which analytes can be determined in which metrics in the presence of which interference. Within these conditions, what level of precision and accuracy can be achieved. These are the things, few things which you will establish by doing method validation. See, now this is a challenge. Again, I come back to the same slide. Who will do validation? What? How? When? What all things to be done? And always validation raises a question, a doubt on analysts. What extent is the validation? See, again, I'll just tell you what happens generally. We, in analytical field, generally we optimize, then we develop, and then we go for validation. It's a cycle. Because see, you can't start validation. It's not so easy to start off. You got tomorrow someone, your in charge has, the lab charge has told start validation. So you can't start off validation. No, tomorrow I'm starting my validation. Okay, it's not so easy. You have to frame something. You need to have a proper procedure in place to do validation. See, I have just touched a few things. These are the performance characteristics generally used in validation, like precision, accuracy, limit of detection, limit of quantification, specificity, linearity, range, robustness. These are all part of things. I think many say there may be some terminology differences like that side. You may hear something called selectivity, like someone may suddenly tell about ruggedness. So these are things which are almost the same what we are discussing into this topic, except that measurement uncertainty I have not mentioned. It will be separate. That also forms, once you complete your validation, you try to use that data to calculate mu. Again, specificity, these are definitions just to make you understand what is specificity. Ability of a method to distinguish between analyte being measured from others or interferences. It's generally the thing what we do. Ability to discriminate also will change from analytical equipments which you use. I think in the right slide you can see it is from the microbiology part to the MS you use, they have the ability to discriminate. But interferences also increases and decreases based on the analyte and based on the instruments you are using. See, ideally I have written how this is a power to discriminate between isomers, metabolites, degradation products, metrics, effects, and it also gives a good tool to differentiate between a false positive and a false negative. I think this is known to everyone, I think, linearity. But it's a relation between the concentration level and response factor, whether it is linear or not. And generally, see, AOC, if you read at many places, they tell 3-point calibration. As on date in pesticide, labs use 1-point calibration, because I think in many regulatory, many documents it is being mentioned that you can use 1-point calibration too. So ideally, mainly in residue analysis and contaminant analysis, people try to prefer a 5-point calibration, so that they try to cover at least their working range. Then something called goodness to fit is there. I think almost y is equal to mx plus b, everyone knows it, that it comes, intercept and slope comes in a calibration. I think that is why I have written acceptability range for the parameters of the curve should be described. Can you tell what is something is written called acceptability range for the parameter? What is the parameter which comes in a calibration curve? As what? As what? As what it comes? Correlation coefficient. See, where you will put an acceptance criteria, where you will put? If a calibration is coming, where you will put an acceptance criteria? See, that's what. See, there is no predefined criteria anywhere. See, we have a tendency to tell that it should be 0.99, 999, 995. See, these are all our presumptions until and unless it is written specifically in some document. See, it can change. Mainly, it's a big challenge with the pesticide residue analysis. It's very difficult even to get 0.99. It is a challenge. So that is why I was telling, very, very critical when you are doing method validation and when we are defining when you are evaluating the part of linearity in method validation. There you will get an idea really how good your residue is linear, a specific pesticide is linear or not. That can be used as a criteria, because method validation is the place where the criteria starts defined for each parameters which I have told. Again, there are many ways, LOD, LOQ, it's a debate. For this what I use, for that what I use, because I have a spectroscopy, I have their absorbance which is coming. At some places I am having counts in the case of ICP-MS. In some places I am having area, height. So where I will use what and which is the actual ideal method for calculating LODs. See, basically I think many people who are working on chromatography would have heard a simple one called signal to noise ratio. Any other, because I have stopped here, I have not talked about any other. So any other methods are there for calculating LOD, LOQ? Can anyone tell?
Yes, one more method is there. Based on the standard deviation of the linearity, we are getting linear curves, we are repeating the linear curves, so we will get the standard deviation of the linearity. And against that, this one equation is called
slope and intercept. You can use it and calculate it. That is one thing, one way of doing it. See, that also comes in one type of chromatography. People use it. See, signal to noise, more noise comes in gas chromatograph. If you see an LC, liquid chromatograph, the noise will be comparatively lesser. So then what he told is correct. That type of the calibration curve method, they use it for calculating LODs and LOQ. But many people have a tendency using GCs, gas chromatograph, to do a signal to noise ratio. There is something else, like in the case of where absorbance are there. Can anyone tell? Some people...
Intensity, number of counts or intensity can be used to calculate.
T tables, yes, there are some people who are doing. But basics, when you do in, I think, atomic absorption spectrometry, many people use standard deviation. Mean plus 3 times SD is being done. Mean plus 6 times SD is done. You run a blank, reagent blank, then you go for mean plus 3 times SD or mean plus 6 or 10 times SD, which is being done when in the case of where absorbance are coming. Or even in the case of places where counts are also there, people do it. Again, this is all, I think it's heard by everyone, people who are sitting here. It's all trueness, accuracy, closeness of agreement between the average of an infinite number of results and a reference value. Then closeness of agreement between a test results and the accepted reference value. So just a slide to give an indication what is trueness and where does precision lies. I think in past 2 days you have been hearing from here to here, so it's all same slides which I'm just repeating. Then recovery is one thing. Again, definition is very, means it is written, but ultimately it is the amount measured as a percentage of the amount of the analyte originally added to a sample of the appropriate matrix, which contains either non-detectable level of the analyte or non-detectable level. See, generally then you do a correction, that is your tendency. But can anyone tell how can, I have given first two, these two are two sentences which are written. Spike at various fortification level, considering the testing and limit. Analyze the sample and calculate the measurement. So you are spiking and then you calculate. Now, how can we calculate the recovery? I have kept the recovery as a question mark. Can anyone tell how it is being done? Anyone? Because it's very simple to calculate recovery. I have given the two things here. Can anyone tell how it is being calculated? It's very simple, nothing. It's just...
Add a known amount of standard.
No, just I told, that is we have told it, but I'm just telling that how you calculate the recovery percentage. Same thing, the measured one into 100 divided by your fortification level. And again the precision comes. See, in precision there again, see statistics is one problem which creates confusion. See, daily regulations change, new values come. We all have restricted, we still calculate, mean, then a CV percentage or an RSD, and we come that it's so much percentage and this is the ideal one and it is within the acceptance. As on that, there are new terminologies which are coming. I'm not going much into detail into that. There are something called, you should estimate, some regulations tell that you should calculate Horwitz. Through Horwitz, you need to establish. So I'm not going that detail into it. Just again, you calculate, you do the same 6 or 7 times. See, the data of recovery can be directly taken here. But here in this situation, you try to do in 3 levels, which we discussed earlier. 3 levels we do it. We again calculate the SD and CV. Just to give this, these are some, this is a published ones. So you can see based on the concentration, the lower the concentration it goes, the higher the CVs. So they are also giving you a freedom, like you are telling that whether I am able to meet or not. See, you can see as you go, as the residue concentration is getting lower, the CV percentage is also increasing. As it is higher, the CV percentage is. This is just a guidance. It's not a real criteria. Many documents will have different criteria.
So where it is published?
See, this as on date is there in almost all international standards. Many of the AOSC tells, many of the European documents talks about it. If you go to SANTI, it is also defined in that. For pesticides specifically, for antibiotic it is separate. So it's all established ones, which is, these are published documents.
Do you have any guidelines for the analytes which are presenting very large quantities, let's say 10%, 30%, 40%?
Higher,
Yeah.
when it goes to percentage.
Yes.
See, there are guidance documents. There are many ISO standards which are published which defines about percentage also.
Can you please?
Yeah, we can share. See, this is within lab reproducibility. Again, it is precision only. That was repeatability. You have to reproduce it on 3 different occasions or using your own changes. You change maybe analyze. There are so many proportions, permutation, combination you do in a lab. So again, same thing, you calculate it, your CVs and the standard deviations and the mean. But see, this is one thing which I had to touch, which is a hidden thing in a laboratory called a range. How you define a range? I think to the accreditation body, I think almost many labs may be enable accredited. So how you define your range? Or during the audit, when the audit is happening, generally we have a tendency to define the range that time. You know your LOQs. It's well defined. LOQs are defined very well. So you start mainly have a tendency to start from your LOQ. But the highest range, it generally happens during an audit day. So you sit in one room and the quality manager tells, yeah, let us put 10. No, we have to put 20 because see, it is a customer requirement. No, let us put 30. So it's a discussion that day, and we just, it's not a clearly defined highest range we give. I've seen labs putting 100 ppm in the highest range, 10 ppb to 100 ppm. See, how can it be tested? What instrument you have? How much you will dilute it? If you have a provision to dilute it, also how much? So I have just touched it. It is clearly written the interval between the upper and the lower concentration in the sample, for which it can be demonstrated that the analytical procedure has a suitable level of precision and linearity. And again, redefined the working range is the interval. Again, I am talking about working range. There are 2 types of ranges. One is instrument linear dynamic range of an equipment, and one is working range. And the working range is the interval over which the method provides results with an acceptable uncertainty. The lower end generally we put as the LOQs generally, or some labs put as LODs also. The upper end of the working range is defined by the concentration at which significant anomalies in the analytical sensitivity are observed. Very important point, that is significant anomalies. See, after that your equipment or your instrument is not able to respond, but still we will write higher values. That is generally our tendency. So I just wanted to touch that topic. Again, robustness, rugged, how rugged, you make deliberate changes, like changes in the solvent, you make n number of changes, you slightly change the weight, you slightly change the temperature conditions of the equipment, like you need to incubate at some particular temperature. You slightly change the temperature and see how rugged is my method. You slightly change the mobile phase, the flow rates, just to see how rugged is my method, because these can happen. So ideally this should be also part of your validation study. See, methods requiring now validation. New, I think there was a question there, new or original methods. Modifications to the existing validated method means you have validated but you have made modification. Now modification, again a question is there, I have written modification. What is the modification? That is a critical thing. See, if you change a method, it calls for a validation. See, you have made major changes in your equipment, it also calls for a validation. One more thing is there, if you, during method validation, one person has done the validation. Now that person has left your laboratory and a new person has joined your lab. It's a challenge. Should it go for validation? It's a question to all.
Verification.
Verification only. Why only verification?
Because it's already validated.
So it's just verification. Through that verification, you can also check the competency of your analyst also. It's like a training evaluation also. See, now method validation I have told very simply, but when you come to the practical work, it's loads of work. It is so many things around. You will have so many things revolving around you. So just I want to also point towards something called the most important thing in validation or verification is this personal in your laboratory. So that person who is doing validation should have knowledge about the technology as well as the need of the lab. See, the requirement of your customer or the need of the lab is from this range to this range. He has validated from the other range to another range. That validation goes for of no use. That is what I was telling about the preparation for validation. See, this is just an example. I put it in this thing. Professor is asking a question. Lysis buffer we are using to isolate our protein. The answer comes from your, it's like a charge. As a postdoc, you really should know how to answer your question yourself. Because the person who is in charge doesn't know. So he is confused. So then again he asks, you don't know even what I am talking about to you. Then again the person tells, in charge tells, see, that sounds like another question. So this happens. I'm not telling this may be a just a pictorial representation, but this is a fact in a lab. The person should know really where I am doing. Validation is not a small thing. It's a tool, and you should be able to really work a background before doing it. Again, some pitfalls I am telling, this also should be understood. This happens, these are practical things which happens in a lab. See, repeating tests until you get the results you want. You will repeat it, I think yesterday it was discussed by Dr. Vasi Reddy. You try to repeat it many times somehow to get it. Actually, the question was very ideal when he asked, I did it 10 times but I didn't get it. The last thing what you do, yes, let us come to a conclusion or some decisions that you repeat and get some value close to that. Drifting from method validation into method development. Many labs do method development only, not method validation. Then adjusting the acceptance criteria after the data is generated. These all happens in a lab. And see, this is practical things. See, validation, you have done all these business. Now you can't go back. And you have managed, see, I'm talking senior person will not allow you, again, no, sir, I didn't meet my acceptance criteria, I want to validate again. Again you will tell, no, I didn't meet, again I want to validate. See, these things, first of all, it can't happen in a commercial scenario, but still I'm talking about event. So that's what a background work really has to be done before touching validation. See, how you overcome these pitfalls. Again I told you, you should have an approved plan. Then go back and start over incorporating all the changes when you do a new validation. Because you validated, you didn't work out. Maybe it may be one place which you created a problem. So you modify that. But still, the old data also should be there and the new data also should remain. Maybe, see, we have a tendency to remove all the old data and put the good data because auditors are coming. So let us show the good data. That's why I have shown here all data should still be included in the evaluation. See, now, what is the uses of method validation? You have done method validation, I told, it should not be in the almaras and the respective cupboards. It's a true thing. See, by truth, if you ask me, you are all people who have worked in the lab and people who are really done validation also. Practically, if you just think and go back, you will know that your validation document is in the cupboard. Ideally, day in and day out, it should be with the respective analyst. The analyst should ideally have it. Because that is the document, that is your Bible for acceptance criteria. Daily it should be verified. And that's why I've told you it gives an idea of the method capabilities and limitations which may be experienced in routine use. And it gives an indication that method is in control. See, during method validation stage, the method was largely applied to samples of known content. Correct? In method validation, how you do it? Mainly in residues. I think few of the laboratory will have certified reference material. I am talking already, like in the case of just example, I am telling you fish. Do you run any residue which is induced in the fish, or you spike it? What is the general thing? Do you run any CRMs? Certified reference material. Which certified reference material?
We have a whole milk powder, we have cattle feed samples, and pig feed.
So that is a good thing if you have it, because CRMs are costly affair. So if you have it, it is good, and that will be a very good thing for method validation. That will be the real tool for method validation. See, this you are artificially inducing it, and after using this method, you are trying to quantify something which is naturally present in the matrix. One is tissue bound and another one is in free form. When you spike, it is free form. Nothing is happening. You are putting a solvent, mixing 100% recovery. Method validation is always good. But the challenge starts with naturally presenting matrix. Tissue bound. There is the challenge starts. And that is why we always people tell that participate in PT, because that's another good indication that you can really pick up the analyte from the matrix. Very good tool for generating control charts, and control charts again is being stressed as on date analytically. That is the biggest tool required as on date to evaluate your data. See, another one important thing I just wanted to come as closing of its documentation, which you can't waive off. Properly document it. You again, by practical experience, I am telling, a validation document is being asked, they bring out all chromatograms. A big file, this much big file, a person opens it, you can't understand what is head and what is tail. It is just chromatograms around and around. See, validation, we have discussed so many things. You need to have acceptance criteria for all this. You may be validating against a protocol. So you should have a defined criteria. And you should properly report it. You have to properly make a report. I think ISO IEC 17025 is catching on to it, that you should properly report it and make a statement that this method is fit for intended purpose. You should conclude that my method, after doing all this, is fit for purpose. Again, just to show you what documentations are, just a generic slide, what should be there. You should have a validation plan, and the outcome will be a validation report. See, this is again, I have taken it from ISO IEC 17025, but people don't read this. It is in the note 3, I think, of ISO, because notes we don't read it. No, but I think ISO IEC 17025's notes are very, very important. And in one of the note it is written, validation is always a balance between cost, risk and technical possibilities. Yes, you have to make your own judgment. In concluding, demonstrate method is equivalent to the reference method in the case for the matrices validated based on defined method criteria. Demonstrate in the hands of the user that the method can be performed to meet the defined method criteria. But method validation and verifications are tools for good food laboratory practice. That can be my message from here with respect to that. And for me, these three are the important: man, machine and the method. And just a few references which you can touch on. There are many guidelines for, like you were speaking about few things, many guidelines are there for many validation. These are international ones which you can touch on to. And just thank you, and any questions which I can answer, I will try to answer. Thank you.
If you are doing the validation for non-dioxins,
Yes.
MRE is given sum of non-dioxin is 75 ppb.
Yes.
Then how we will calculate the LD for individual?
See, it is very clear that you are having how many compounds in there? 6. And you have 75. Ideally, you should have a capability below. You divide 75 by 6. So how much it comes? 12.5? 12.5. You should at least have the capability below that. Otherwise, you have a chance of reporting a falsely negative result. Chances are there. This is again, you are talking about the non-diaxial like PCBs.
So if you have got the client method, then you have to do the validation, same parameters you are following, everything.
See, this is what again I told you, it's your judgment for whom you are doing it. First you have to, it's a client. See, client tells me that you don't require a validation, but there is a risk here. Tomorrow you are a lab accredited by by the accreditation body, surely you are going to see, you need to comply strictly to the requirements of ISO IC 17025. See, if you are not complying there, you have a provision, or whether you are not putting it inside the scope of accreditation, you are doing it only for a particular customer, and the customer doesn't require accreditation, then fair enough, you can verify the method and you can use it. Yes, sir.
Yeah, you have not covered the matrix match, because during the recovery there is a lot of issues, sometimes low, sometimes high. If it improve the matrix match, that will give them more confidence for the man.
See, that is one important thing which I didn't touch because of the lack of time. I didn't go in depth of method validation. See, there was some discussion, I think Dr. Anshu was just talking about something called pure standard calibration, and then she talked about matrix match and she stopped it. Mainly because she was focusing on pesticide residue. Because she told that you prepare the matrix, then onto that you start adding so it's something called matrix match. Now there is something called in Sandy called procedural calibration, which is like you spike in the matrix in the initial stage and do the whole activity like the sample. See, it's like you are treating the standard and the sample on the same platform, which we also tell as matrix based calibration. See, now the criticality in all the three steps is your slope. Slope is indirectly related to the sensitivity of a method. I think, can you tell where the slope comes? Where does it come, slope, when you test? You get y is equal to mx plus b. Where is the slope? So that slope between the pure standard, between the matrix match and between the matrix base, you can see if you plot recalibration, it will vary. And if the idea, it is also defined in literatures that if the slope is varying between pure standard and the matrix match more than 20%, you should ideally go for matrix match. Then when you compare matrix match and matrix based, again there is a difference of more than 20%. Your last option is but to go for matrix based or procedural calibration. These are well defined in literatures. So actually it is a requirement during method development. A cycle came there. Ideally you need to, before starting a method validation, you should check this. Pure standard for an analyte, matrix match and matrix base. Then come to a conclusion that which can really be used. Because otherwise, like sir told, it's a challenge, recoveries will go. During method validation everything is good, but when during analysis everything goes wrong.
Matrix match means only the superficial addition of standard or matrix extraction.
After extraction, the extracted solvent or the extract is being
used for the addition. Matrix base means through procedure.
Through procedure.
Through method.
Through method, procedure, whole procedure will be taken to consider.
So you need to spike the sample
from the initial stage and for all the 5 calibrations. And it will go, that's what is in the new, I think the new terminology, the best terminology, procedural calibration.
One more thing, just like that.
I think you can use mic. That was an advisory so that people can hear what.
How will you calculate LOD and LOQ for non-instrumental method?
See, non-instrumental methods, most of the standards, like when it comes out, generally it will be defined clearly on your, see, when you come to a non-instrumental method, generally go for either gravimetric, volumetric it comes. So generally you know your requirement and generally you check it at that level, either through a primary standard, you check it, spike and do it at that low level, whether you are able to detect it. See, all our measurement is a value. So you check it, and generally in methods it will be defined your lowest range and the highest range, that this method can work from this range onwards. So generally we try to check it onto the lowest method. See, you need to check, otherwise the problem starts is many of the samples which you are trying to check will have only naturally incurred things. So, and you try to, generally the labs is that you repeat it 6 times and you take the lowest resolution of your balance as your criteria and put it as the lowest one. Some labs have a tendency to use standards and check it. So these are, this is a, it's a good question, and it's a challenge when you are doing with respect to non-instrumental techniques which you are using.
Because we want to define the LOD and LOQ of that particular method. Suppose that method given the range, it should not be applicable for less than 10 ppm. Okay, then it's a stop. Okay, below 10 ppm, that method is not okay. But then you have to start from the higher than the 10 ppm, right?
Now you are talking about the highest range or the lowest range?
Lowest.
See, the wherever values you see, you know your requirement. See, that's what I was telling you. Your knowledge should be used. See, the question you should also think is that what metrics, what is my purpose, what is the requirement. Specification is there. So against your specification only you will define your range. So ideally your lowest range and the highest range has to be checked. Either it should be verified or it should be validated. So you need to check at that value which you define. Either it's, that's what I was telling, the most critical thing, range. You have to define it. It is not that you are checking LOD. See, lowest range should be ideally your LODs or LOQs, which you have to define, or as per the specification. It's nowhere written, it is written that X lab should have this range, Y lab also should have that range. Nowhere it is written. It is based on your capability. You have a balance of that capability, you will do it. You have a pipette, your burette with a higher resolution, you will go lower. It's all dependent on the capability, the facility you have in your lab.
Actually, this is not a question. I think this one point we may discuss some points.
Yes.
One is that actually what is a standard method? Because there are different levels of methods are available. AOEC is having multi-lab validated method, single lab validated method. Going to the research publications, publication in itself is varying. There's a low impact factor publications, are high impact factor. So basically, how will you select a standard method?
See, the thing is, you have talked about something called low impact factors and high impact factors. So that comes in the form of journals. So we remove it out. We don't put it. So generally, standard methods are, I think, Eric will be also the right person. He has been, he is the former president of AOAC. So he will be, I think he may touch also on some topics with respect to the standard methods which we need to use. But generally we follow that AOAC, ISO methods, our IS, all the IS methods are considered as standard methods, mainly with respect to, so we see these are established methods, wherein which these mainly we are talking about some performance criteria. Those are already done, established, verified and documented. See, then there is a question that in journals also it is documented. Why not we use? So it's categorized. Standard has also categorized it. So we are bound. See, as an analyst, we will have many things which we may have to ask. See, like this is a good question. Like whether all the things are also done in a journal. A journal has published a method. In that also everything is done. Why can't it be considered as a standard method?
And there's one
Say Eric.
application note, given by the application